So I actually got reintroduced. I did a lot of wilderness when I was before college and med school, and then ended up getting married and having a couple kids, and some things got on the wayside. So I actually got back into it when a few students, probably now 8 years ago, wanted to start our WMIG group. And so I put myself through some training to try to get some expertise. So it was actually students that got me back into this. That's Mongolia. That's a great place to do outdoor stuff. It's relatively untouristy. People are very polite. There's very little crime. There's a little bit of corruption, but it doesn't really affect you. So I climbed the highest mountain there, Mount Teton, last summer, and so I don't know. It's an out-of-the-way place, but it's a great, and there's lots to do there. Gobi Desert, the northeast. There's a lot of horse trekking, and then in the west is where the big mountains are. So I wanted to go over, like, you're going to be getting some bleeding control training upstairs. So I just wanted to go through like what the importance is. So this is actually military data from Afghanistan and Iraq conflicts. And so the military was obviously very interested in how their troops are dying and what they can do about it. And lo and behold, so they actually, just started taking count of who was dying. And then when they did their autopsies, they looked at what deaths were potentially preventable. As far as once, you get shot through the head, is that a preventable death? I mean, from as far as giving aid. Well, no, if you're shot through and through in the head, it's 100% mortality. So they can't do anything about that. But they, so they want to concentrate on injuries that the medics can actually make a difference. And it doesn't totally translate to what we're doing in the wilderness, but I think the numbers are pretty close to how people die in the wilderness. So the number one thing they noticed was like almost 2/3 of the deaths, preventable deaths. So the person's injured, he's got shot through his thigh, that people were dying unnecessarily from extremely bleeding. So what did they do about that? Yeah, tourniquets. So tourniquets, like when I was working EMS and also in med school, tourniquets were like, verboten. You lost, like, if someone got a tourniquet, they like got almost an automatic amputation because people thought it caused so much damage, and there were terrible tourniquets made. So the first thing they did was everybody in the military that's in anywhere near the battlefield carries 2 tourniquets. So that was the first thing they did. And so then they started chopping away at the 61%. So that's why you're going to spend a fair amount of time on learning how to apply a tourniquet. And no matter what, if I'm in the wilderness at all, away from urban EMS, that is the one thing I'll have, even for a trail running or doing a day hike. I'll always have a tourniquet. And you should always think about, when you start thinking about your medical supplies, is think about what you can improvise and what you really can't improvise. And people fool themselves on what they think they can improvise in a timely fashion and what they really should be carrying. And there's some people that are nuts about carrying, micrograms of equipment. But if you're gonna be safe in the wilderness from a medical point of view, you're gonna have to carry a little bit more weight than some people think you should. What else could you do about extremity bleeding?
Put pressure on the wound.
Yeah, that's like number one. That's what they teach you in first aid. Just put hand pressure on it. And they usually can't control it unless, again, the wound is bigger than your hand or two hands. If you can actually get down, if the wound is deep and like your femoral artery is bleeding, and if you can't get pressure directly on the femoral artery, it's going to continue to gush. So that should be your first step, is to put pressure on. So say you get the bleeding under control with hand pressure, then what do you do?
Rapid pressure.
What's that?
Rapid pressure.
Yeah, so if it's a big wound, you have to fill in the space, because again, you have to get the pressure transmitted into the deepest part of the wound, because that's probably where the artery is that's bleeding. So you got to stuff the wound, and then put some kind of absorbent, because it's going to continue to bleed. You don't want to have to change the stuffing in the wound. You want to put it in and keep it there, so as the bleeding soaks through, you have a dressing on top that you can change. And then on top of that, a compression bandage. And my go-to compression bandage is Coban. So I carry a couple 2-3 inch Cobans. You can get in trouble with Coban because it's you wrap it on and it can actually induce more pressure than you think it is. So if you have like a large dressing on, you can usually put as much pressure on it with Coban as possible. It's very light. You can actually squash it together to make it, easily pack into a first aid kit. Any other ways to stop extremity bleeding? How about old wives' tales?
You're gonna stop bleeding eventually.
All bleed, that's the number one thing you learn in surgery, is all bleeding eventually stops.
We still use those yearly bandages?
Right, so that's part of, this Israeli bandage is just a compression dressing and that has some hemostatic on it.
Yeah.
So it's basically combining two functions. So the stuffing you put in can also have hemostatic stuff on it. It does increase the price, probably about $20 a roll. But you can just get a gauze bandage and use that as your stuffing. That's the cheapest and lightest. We used to say like elevate the extremity. That does very little. I mean, if you have any kind of blood pressure, you're going to be able to compensate for any gravity. So those are the basic ways. What do you see? What kind of wound do you see up here that they don't consider preventable? So groin and axilla. So again, the body armor that the typical infantry person wears it's very difficult to cover the armpits or the groin. And so people know that's where you shoot, soldiers that have body armor. And so those are very difficult, and they haven't really come up with a great way to prevent those deaths. You can put pressure, you can pack the wound as hard as you can, but they're trying to develop devices that actually put pressure on those kind of wounds. Tension pneumothorax. is number 2. And so how do you fix a tension pneumothorax? What's that?
Decompression.
With?
Needle.
Okay, so can you improvise that or not?
Depending on what you have, I guess.
Okay, so what would you have to do, improvise it?
Camelback tube.
Okay, camelback tube. So camelback tube is that wide, so how are you gonna get that into the chest? A pen? You're gonna push a pen through? I mean, how do you, has anyone seen a chest tube put in the hospital? So how do you do it?
Skeleton.
Yeah, you need a knife, some clamps. So it's a lot harder, so to try to improvise all that stuff, very difficult. You know, the last group said, a multi-tool knife. But if you're not experienced, you can get into a lot of trouble sticking a knife blindly into the chest. What kind of things happen when you do that? They're all bad. We got that established. But what specific injuries? You're going to come across this when you're putting in your first chest tube. You better know this stuff. Okay, you puncture a lung. So the pneumothorax wasn't big enough. Like most of the time, there's a big pneumothorax, and you got plenty of room to put your fingers in and get the tube in without hitting lung. But if it's not a big pneumothorax, and that's why these days it has to be a pretty big pneumothorax to bother putting in a chest tube, because you can produce more injury. It's a small pneumothorax. What arteries are on the chest wall?
Intercostal.
The intercostals. So where do they lie? Superior or inferior edges? They're inferior. So a little quick anecdote that I actually heard in Nairobi by a student that was there at the time was when Ronald Reagan was shot as president. He actually had a pretty minor injury, just went through the lung. But he had a pneumothorax, and of course you needed a chest tube. And who do you call to put the chest tube in? The President of the United States? Yeah, like the chief of cardiothoracic surgery. And when's the last time you think you put in a chest tube? 20 years. Because he has the residents and students to do it. So he actually lacerated the intercostal artery, and that's why Reagan had to actually go to surgery. It was the repair of his intercostal artery. So you can get in a lot of trouble sticking things in the chest. So I'll go through what you should be carrying, and again, I will say you can't improvise this. You have to have a commercial needle decompression kit. Now, I don't carry that if I'm going on a run. But if I'm going anywhere where there's going to be potential for a significant fall, or hitting downhill mountain biking and hitting a tree and breaking a bunch of ribs and getting a pneumothorax, I have one. So I carry 2 tourniquets and 1 needle decompression. And then airway obstruction. What is airway obstruction usually from? What's causing it?
Trauma.
Is someone choked? Is someone like strangling a person? So why in trauma, what's the most common reason you don't have one? You have airway problems?
Blood.
Blood?
Blood.
Okay, what else? honk to the head. So you have a bad head injury, that's the most common reason why you lose an airway. So that's only 6% of the time. Now, probably in the wilderness, I'd say extremity bleeding is probably less than 61%. Losing the airway, because there's a lot of head injuries. You know, the military has pretty significant headgear. So if you get a head injury, you know, it's usually a pretty big explosion. So we probably have more of airway problems from head injuries because people aren't wearing their helmets, and the helmets we do wear are questionable value. So to that gives me, that tells me what to carry in my first aid kit. So this would be like my kit, especially going overseas, because no one's going to have anything, especially if you're like the only doc, or a long hiking trip or a climbing trip. So you need wound dressings, and I spend the extra $20 to get hemostatic gauze. How much extra bleeding that stops, it's kind of questionable, but you know, if it's me that's bleeding or a significant other, you know, I'll spend the $20. Carry 2 tourniquets for that, and then a needle decompression. So unfortunately, these are probably 35 to 50 bucks. Always get the biggest gauge and the longest one that you can find. Because if it's too short and you don't get into the pleural cavity, you're just putting another hole in the person. So now I think there's 5.5 inchers for the, and there's bigger people that are going out in the wilderness. Safety pin, that's my airway. I don't carry any nasal pharyngeal tubes, oral pharyngeal tubes, certainly no endotracheal tubes. You're never going to use them, and they're a waste of space and weight. So a safety pin, you just put it, the needle through the tongue, and then bring it out through the lip, clip it, and that'll keep your tongue away from the back of your throat. So that's my only airway adjunct. I don't, local anesthetic, unless I was like expedition leader or going to be in a camp for a long time, like a fire camp where the fire's going to go on for 2 weeks and people are going to come in with lacerations you're going to close. In the wilderness, I don't keep local anesthetic. It comes in glass vials that usually break pretty easily. It doesn't take the extremes of temperature very well. And I think if you're in the wilderness, you got to be able to take some pain. So I don't carry any local anesthetic. Some kind of antibiotic ointment. If you really want to go native, you can use honey. Again, the really important, the antibiotic ointment, the most important part of it is actually the Vaseline part of it, because you want to keep a wound nice and moist for it to heal. The antibiotic ointment, again, probably changes the infection rate like 5%. For cleaning, for rinsing out, the most important part of wound care after you stop the bleeding is to get it clean, to decrease the risk of infection. So any water you can drink can be used to wash out a wound. So never, ever, even in the ER or wherever, put an antiseptic in your wound irrigation. Orthopedists still do it. It's witch doctor stuff. There's no evidence. The antiseptic, if it's going to be killing germs, what else is it killing in your wound? Yeah, healthy tissue, so that doesn't seem to make much sense. Pain medications, we're on a, anti-opiate craze. And I think the pendulum has swung too far the other way. Narcotics are really important, not just to be humane to somebody, but if someone has a badly even fractured ankle or badly sprained ankle or something else on the legs, you can turn them from someone that has to be stretchered out to somebody who can actually walk out.
Do you have a narcotic preference?
Oxycodone. So that's got the most, it's the cheapest and it's got the most potency. And it's easier to titrate. And the last group asked, like, where do you get it? You should get it from your PCP if they're willing. Again, like I said, we're on an anti-narcotic craze. So they may or may not be comfortable taking care of your wilderness needs, but there's always, Portland must have 10 travel clinics. Every major hospital system has a travel clinic, including ourselves. Ours is run by Family Medicine and CHH. And so, you get your rabies shots there, your malaria prophylaxis, and then they'll give you some pain medicine. But also have Tylenol and IV or some kind of non-steroidal. So you use Tylenol and a non-steroidal together because they work synergistically. So again, the military not only carries injectable narcotics, but every soldier has Tylenol and ibuprofen to take for pain. And then you need an antibiotic for possible wound infections, and this is most important for open fractures. So that means 10.
5 minutes.
So someone has an open fracture, you get the bleeding under control, and then the next thing you do is get some Keflex in the mouth. So that's all around. If you could carry one antibiotic, that's the one you should carry.
Question.
Yes.
Where would you purchase the needle decompression and then the hemostatic?
You can get that. You can get it online.
Amazon or
You can
other?
Amazon, but make sure it's a brand name.
Okay.
There's medical distributors.
Do you have a
No.
preference?
And I use McKesson. Boundtree supplies. Boundtree probably the easiest. That they supply most of the EMS agencies around here. So.
Thank you.
Now for medicine, you're going to have a medical license. So someone might have to buy it for you if you're not already a physician. So wound closure, there's only 4 ways to close a wound. So suturing, I'll say very little about. It's not very practical for the wilderness. It's a lot of gear you got to carry. And suturing has the highest infection risk because you're putting some kind of thread that has, little grooves in it that carry bacteria, no matter how sterile you want to be. So it's just too much to carry, and it's very slow to close. Actually, in the ER, I use a combination of, for wounds that are under low tension, especially the face, I use steri-strips and glue on top of it. So we'll be practicing doing tissue glue over there. And then for larger wounds, you're gonna, I use staples. And we have the 35 shot staplers they use in the OR or in the ER. They make a 5 shot, so I carry 2 5-shot staples. And again, we'll get into more like what wounds you should close. But in the ER, in the wilderness, we close too many wounds that eventually get infected, and we should have known that in the first place. So if someone has a gaping leg wound, that probably shouldn't be closed, because you're almost guaranteed to get it infected. So you rinse it out, you wash it out as much as you can, dress it up as best you can, and then they can get it closed whenever you get back to civilization. They're not going to die from a bad scar, but they will die from staph sepsis. I did that, so obviously we're in the wilderness, so very few wounds are going to be considered clean. Scalps are always, you can rinse them out enough. There's so much vasculature that you can close just about any scalp lac and it'll do fine. And that's where number one place to use staples. Again, the face, you can get away with glue. And again, that's also a very low risk infection. So if you can get it cleaned out, you know, unless they did a face plant in some manure or something. It's, you know, most people don't, when they get their facial lacs, usually don't get them very dirty. So those usually you can close with glue. The trunk is intermediate risk. Again, depending on how dirty it is, but again, always err on the side of not closing. The extremities are the highest risk. They have the porous perfusion, and they're dirty. And leg is especially high risk. Why? What bugs live on your legs?
Anaerobes?
Yeah, where do the anaerobes come from? Your poop. So your legs are colonized with E. coli, so they're especially high risk. So the worst wound infections that have been closed I've seen have been leg. You know, perfectly clean leg. You know, they fell in their house, somehow caught their leg on something, big gash, closed up, comes back 2 days later with a horrible infection. So any leg, I would say, as a rule, I wouldn't close any leg wound in the wilderness. I'll be very selective in the ER. And that's Mongolia again. All right, any questions?
Okay.
Someone's got to have.
Nope.
Someone's got to have. Yes.
What are your thoughts on Tagaderm? If you butterfly it up, put Tagaderm on top.
Yeah, that's fine, except Tagaderm is sealing it, so that increases the risk of infection. The less drainage you allow for any given wound, the tighter it's closed. That's why glue is also a high risk for infection. So if it's a dirty wound or in the hair, you can't use glue because that seals it up and none of the bad humors are getting out. So if it's a perfectly clean, like especially a facial wound, that's fine.
Do you bring like syringes or anything for pressure for bleeding, or
Nope.
you just gotta scrub?
All you need is running water, so just use your water bottle.
Are you telling people to do needle decompressions these days? The second or the fifth? Intercostal spirits?
I do
Fifth, yeah.
just where a chest tube would go.
For a large open wound, one that you're not gonna close, and like say you gotta get somebody out, do you just keep it kinda damp and hold them out?
Yeah, you gotta keep it moist. Again, that's the most important reason you're carrying the antibiotic ointment. At a minimum, if you keep it covered with gauze, or again, if you're really out of luck, you know, a clean shirt or something, but you gotta keep it covered, because you don't want it to dry out. A dried out wound won't heal. That'll just start dying from the top down. So you gotta keep the wound moist to keep it viable so the cells can regenerate.
Did you drink fermented goat milk from Mongolia?
Yes. It just gave me PTSD. It's not as good as it sounds. There's not that much alcohol in it.